Hello everybody. In today's session, I will discuss about the CKD and its relation with the edema. As we know, the kidney is a very important organ for our body. It has many functions like excreting the waste products from the body, regulating the fluid balance in the body, regulating the acid-base balance in the body, and also it produces hormone which is helpful in production of the hemoglobin from the bone marrow. So it is a very vital organ. Impairment of the kidney function can lead to loss of these function and also other many problems which can occur after development of the chronic kidney disease. The chronic kidney disease is divided into the five phase. In stage 1, the kidney function has more than 90% of the kidney function is preserved. In stage 2, there is a kidney function remain between the 60 to 89%, and in stage 3, the kidney function drop to between 30 to 59%. Stage 4, there is a kidney function is 50 to 29%. And when the kidney function drops below 15%, it is the stage 5 stage of the CKD, which is end stage renal disease. So these are the various stages of the kidney disease. Also, the symptoms usually comes late when the disease is already advanced, because we have two kidneys. If the loss of one kidney function is there, the other kidney tries to compensate, and when the other kidney also fails, then it is very late, and the kidney functions are very much deranged at this level. And patient usually have symptoms of swelling over the body, especially at the leg or the face, loss of appetite, nausea, vomiting, or there is easy fatigability, or other symptom is having froth in the urine. So as we see, the most important symptoms is the fluid overload or the accumulation of the fluid in the body, which may be in the form of the edema or the facial puffiness. So what is the relation of the edema with the CKD? So basically, the edema is the accumulation of the extra fluid in the body, and it is usually starts with the swelling around the feet or the face, which is the earliest sign of the CKD. And this edema occurs because of the basically two functions. First, because of the two problems. One is the loss of the protein through the kidney. Another is impaired kidney function, which lead to accumulation of the fluid in the body, which normally kidney usually regulate and remove the extra fluid from the body. But when the kidney functions are hampered, the kidney is unable to remove extra fluid from the body. Now, coming to the entity that which causes loss of protein through the kidney in the urine. The important entity is the nephrotic syndrome, which is not only seen in the elderly person but also seen in the young kids also, because of the infection. And basically, in this, the body protein, especially the albumin, is excreted through the kidney in the form of the urine, mixed with the urine. So there is a deficiency of albumin in the body, and there is accumulation of the fluid all over the body, especially at the leg or the face. And this it basically the it produces two type of symptoms. One is the swelling all over the body. Another is the shiny stretched skin because of the fluid accumulation. And what how we can deal with the problem of the edema in CKD patient? First is to reduce the salt intake and identify the products which carry large amount of the salt, and we have to avoid that large salt containing substances, especially the preservatives or the uh, uh, storage products which have high salt content. These products should be avoided. Another treatment is use of diuretics when the kidney is unable to uh, pass the urine. So we give the diuretics, which has an action which promote the kidney to remove extra water in the form of the urine. and the or gradually there is edema subside and facial puffiness reduced over the period of time. Another thing which is can be used is compression stockings. Uh, just before the because of this compression stocking, the fluid is squeezed from the subcutaneous tissue to the intravascular compartment, and that is passed through the urine. And the last thing which we can produce is the body position. We should elevate the leg for 30 minutes above the level of the heart, so that the edema gradually subsides and the swelling over the body gradually reduced, and the patient gets symptomatic relief. So this was the basic insight about the edema and its relation with the CKD. Thank you very much.